Mayor Fulop killed that out. And when I was texting the Mayor Fulop, it said, it's a coronavirus, we got to be careful. That was the first step. So you probably have to give Fulop the kudos for being the first guy to react. But yeah, I think everybody, from the feds to the state, we were all caught by surprise, at least the public was. Maybe the feds and the state knew more than we did because there were coronavirus committees put together, but we were slow on the go. And hopefully we're picking up on that. You Social Security recipients, you are going to be the first people to get your stimulus check, probably around the 17th, if it's a direct deposit, which I think all the Social Security is. If you get it by the mail, it is going to take a while, possibly into August. They're going to cut like 5 million checks a week. You figure there's 330 million people in the United States of America. Figure 200 million are adults who are going to get a check. 5 million checks a week divided by 200 million. Yeah, that's going to drag us into August. Hopefully they come up with a quicker plan. But, getting that money, $1,200 or so in August, isn't going to make it. We need something. We need it now. We need something for the mortgages. Governor Murphy was talking to the banking institutions, but it came down, he said, to your relationship with your bank. There is no kind of grace or break on the rents. Mortgages will be tough because the mortgage also includes your principal, you got your property taxes, you got your insurances, so there's a lot of waiving that goes on. That hasn't come across. We got over 10 million people unemployed in the United States. I think New Jersey was like 780,000 last week filed for unemployment. Keep in mind, that's who got through. Paycheck protection, for that matter, today, you small businesses, I'll be doing this myself, go to cv.business.nj.gov and see what help you can get. Any small business, file for everything you can. In Jersey City, Mayor Fulop is matching grant money if you're a Jersey City business with a physical storefront. There is paycheck protection coming on April the 10th, but there was some talk of that being stretched out to the end of April to May. Everything is so fluid. But these are the things we need to get done. We need some relief for the people who are unemployed. They can't pay the rents. We need something for the property owners. Let's get to the statistics. Now remember, we talk about how many cases globally. There are billions of people in the globe on the earth. Billions of people on the earth here. Worldwide, we have 1,000,000 40,988 cases. Globally, 55,195 people have died, but a very important number is how many recovered. 203,774. That is a plus in one day of 18,558. There are active, we have 763,741. Of those 763,000, 725,056 are mild. 95% of the cases globally are mild. Serious cases globally is 38,514. For that matter, things are starting to lessen. Our coronavirus is slowing in New Jersey. Same thing in New York, but we are the epicenters. New York, New York City, and New Jersey because of proximity. For that matter, in a little while, I'm going to show you some maps. Now, we're doing this remotely. We're trying another method here between Ready to Roll Studios and Hudson Media. This way I can bring in people from the hospital industry, elected leaders from either of the studios. We're hoping to start doing something along those lines next week live, and we don't know where we'll be broadcasting. We're trying to limit the amount of people in the studio, if possible, to no more than 2 people. In the United States, we got 245,442. I hope you're seeing these stats because I don't see them here. That's something we got to work on. In the United States, 6,099 people have passed on. And keep in mind, a lot of these people had underlying medical problems. Recovered in the United States was 10,411. That is a plus from yesterday of 1,137 people. Let's see that USA map, John. Now, John is doing our switching in the Hudson Media studio in North Bergen. If you're watching your local newscast, some people are working from their bedrooms, and there's somebody in the studio who's doing the switching. So hopefully you see the hot spots, that is New York and New Jersey, New York City in particular. Over 60% of the New York cases are from New York City, and that's how it's affecting us. I had stumbled over a New Jersey map. This is all courtesy of the New York Times, by the way. John, if you can put up that Jersey map. Hopefully by now you're seeing that. And again, you see the closer you are to New York City, New York, the bigger that red dots are getting. As you get further south, things lessen up quite a bit. So what we should be doing, we should probably bring what resources we can from South Jersey up to North Jersey, even on a daily commute, or they stay overnight. In Jersey City, we got a bunch of Airbnbs that are probably available, and rentals and hotels that are empty. If we can bring these people in from South Jersey to help out in North Jersey, I'm sure, because the hospitals are going to be getting a lot of stimulus money. Hopefully they get it faster than we do to maintain, because the hospitals, they're not doing the elective surgery. But fortunately, in New Jersey, we got 2 monster medical groups. Of course, RWJ Barnabas Health, our Jersey City Medical Center, multi-billion-dollar organization, so they can hang in there a while. And the same thing with Hackensack Meridian, multi-billion-dollar operation. And there's some lesser hospitals that are holding their own. And I've been talking to these hospitals for the last week. We're hoping to bring them in at least once a week to give you an idea of admissions and what the discharge rate of the COVID-19, and there are discharge rates. The United States, we have 5,421 serious cases in the United States. And if you divide that by 50 states, we're talking 8.3 per state. So, again, you got to look at the entire numbers. We got a country here of 331 million people, and we're talking 245,000 cases of COVID-19. It's kind of lottery numbers. Not to dismiss it, we have a pandemic going on. But if we can control it, and we're way ahead of a lot of other countries, I'll get to that in a minute. New Jersey has 25,590 cases. 539 people have passed on. Again, 95% are mild. Like I said, we showed you the map. Maybe we pop that up one more time, John. Show that New Jersey map again, since I have the note to say show the map here. Show that New Jersey map as I give the rest of these numbers for the counties. And look at the red dots. Proximity to New York City. New Jersey, Hudson County, we got 2,270 cases. Ocean County's got 1,371. Bergen County, Proximity. 4,099 cases. Jersey City, we started the week, well, I think, with 820 cases. Right now, we're at 902 cases. Now, somehow Mayor Fulop is getting test results a lot faster than most. Kudos to Mayor Fulop. New York City has 57,159 cases. Of that, 1,500 people have died in New York City. New York State has 102,863. Statewide, 2,935 have passed on. Testing centers. John, would you put the testing centers up? Give John a moment here as I sip some coffee. You know the best coffee pots are the cheap ones? Yeah, I got like an $80 coffee pot in this studio. This thing is a pain every time I make coffee. In North Bergen, I got like a $20 coffee pot. The thing is flawless. Testing sites. The PNC Arts Center was closed today, Friday. It's going to open up again tomorrow, but that is for first responders. Hudson Regional Hospital, Secaucus is testing. It is pretty much all by appointment. Bergen County Community College, I think they also closed today. Riverside Medical Group in Secaucus, appointment only. They're doing testing at Newark's Weircrack Park. William Patterson University, the Bayonne Medical Center has been doing tests at the drive-through test at Heron Veterans Stadium. Ocean County Community College, I think they stopped today. They'll probably reopen tomorrow. And you got in Jersey City, the FD headquarters on Marin Boulevard. That's a walk-up, but right now I think they're just doing first responders. Same thing with the old DPW. If you don't have symptoms, first thing I do is the temperature. And really, that's the first test you should do at home. Like my wife does every morning, she takes my temperature. Your symptoms: runny nose, sore throat, cough, fever, difficulty breathing, a loss of appetite, loss of taste and smell. I have no fever, and certainly no loss of appetite. If you have type A blood, be extra cautious. The data is starting to show that you're more susceptible to that. Remember, 95% of all these cases are mild. 25% of the people are asymptomatic. Made in America, we got to bring that back, and we got to bring back manufacturing. And I was watching Tucker last night, Tucker Carlson. From 4 o'clock on, I watch news shows, from NBC to ABC, Channel 4, Channel 7. I watch NJ News here, News 12 all the time, Channel 11, WPIX in the morning. I watch news. I'm a news junkie. Tucker reported on 3M, who's the maker of the N95 mask, who have authorized distributors that you can only buy from. The authorized distributors are selling to everybody but the United States. President Trump must have been watching Tucker last night also, because he put an immediate stop to that by using the powers of the War Act. So we'll be getting those 3M. We need to bring manufacturing back to the United States, especially the vital stuff that we can crank out if need be, as needed. Mask, the ventilators, it's got to be like what Ike did. After World War II, when Ike became president, he instituted the interstate highway system. It wasn't so we can move from coast to coast. His idea was to move military quickly. Well, Trump's got to do something along those lines to bring these manufacturing jobs back. We'll be self-reliant. We'll put people to work. It's a win-win-win. Whatever we have to do, and maybe we make some tax deals, whatever we got to do. If we can pop up with trillions of dollars in the stimulus, we could probably pop up with some money to attract these businesses back to the good old USA. Private bus transportation. That's starting to become a little limited. Bus lines shutting down. Lakeland Bus, Suburban Bus, Decamp Bus. They have all closed operations. Decamp didn't want to go into New York City anymore. I guess you can't blame them. And if you are taking public transit, we have to do something to safeguard you. I don't know what it is. If we have to sanitize these trains and buses every day, they are basically COVID-19 tubes. Be careful. Like I said a few times jokingly, wear a scuba suit if you have to. I need you to stay healthy, wash your hands, don't touch your face, stay at least 6 feet away from somebody, mask, gloves, stay home. I know it's hard to stay home, especially with the weather turning, but there is light at the end of this tunnel. The United States has the most cases globally, but when you look at how we're dealing with this, we had 244,000 on this chart I'm looking at, again, courtesy of the New York Times. We've had 244,000 cases, 6,257 people have died. Spain had 117,000 cases, 10,935 died. Italy, 115,000 cases, 13,915. We're handling this. Now, like I said, we may have been slow on the go at the beginning, but we are handling this. We're keeping the mortality rates down, and as we test and we treat and we isolate and we stay at home, we'll all be safer. You be safe. You be good. Let's have a good weekend. I'm Pat O'Melia. Good night.